The trend word out there is well-being, right? So well-being, we want nurses, everyone to feel like they are in a state of well-being. Well, we know that well-being is really static. It's like in the present moment, I'm feeling well. Whereas really self-development is about well-becoming, because it's a much longer journey of a never-ending journey of well-becoming, right? That always has to kind of be a major part of who we are and what we do, because without that experience and being able to really develop ourselves, we can't sit with the suffering of others and really do a meaningful job with them, or take on the suffering ourselves, or, all of those pieces. So
welcome, everyone, to the Integrative Nurse Coaches in Action podcast. My name is Nicole Viano. I am your host, and it is so exciting because we are moving into season number 5 of the Integrative Nurse Coaches in Action podcast. We've interviewed over 80 different nurse coaches of the world, specifically from the Integrative Nurse Coach Academy. And today, we're opening up season number 5 with a very special guest who has been on our podcast, but that was back in 2022. It was episode number 25, which of course I'm going to put in the show notes so you can review it. But we are welcoming Karen Avino back to our podcast. And Karen Avino Karen, tell us your exact title.
Okay. I'm executive director of the Integrative Nurse Coach Academy, International Nurse Coach Association. And also we have a nonprofit, the Integrative Nurse Coaching Association, which is something that you'll hear more about in the future.
Awesome.
Yes.
So I am very happy to be sharing time and energy with you, Karen. And I know our listeners are very intrigued about what is it that we're going to be talking about today, especially having you on our podcast. So welcome, Karen.
Thank you, Nicole. I'm very happy to be here, of course, with you.
Yes. And I love just having conversations with you and feeling inspired after each of them. So I know our listeners, of course, will also feel very inspired. So we do have to take a quick trip down history lane, because I'm sure a lot of our nurses would love to know how you even started and connected with the Integrative Nurse Coach Academy. How did this all happen for you?
Oh, gee. Well, let's say that I would say my whole nursing career, which next year will be 50 years, which is, I'm totally amazed at,
Yes.
I've always been holistically focused, I would say. Started out in maternal child health. And that's where I learned about at that time we were doing Lamaze with moms, which we were using guided imagery and relaxation and breathing and all of those, pieces. And I would teach it, but it wasn't until I went through that experience myself that I really felt the power of using those techniques, especially in a situation like that where you're, having a baby and childbirth and all of that. And then went on to other things like as a lactation consultant, started to use herbs and cabbage leaves and music and all different components with moms to, try to help them also feel more comfortable in their role with their new baby. So I was always holistically minded and just continued my education in different specific techniques, topics, things that I could use with patients. And then, of course, I found the International Nurse Coach Association when it first started. I was from cohort 2. And, once you experience something like that, you're like, this is my tribe. Because before, you felt alone. You felt alone in your um, your beliefs and your values about what healthcare could be and how nursing could use interventions in a way that didn't need a doctor's order. We needed to expand our nursing ability to be with people, rather than just doing do. We really were practicing nursing the way it's supposed to be, with being with people. So through that experience of taking the program, you met more like-minded people and, you know, just felt the love really
Mhm.
that everyone shared with one another, and the support and the encouragement and the brainstorming and the expansion of what, nursing could be. So that's where we are today, because it's really become my passion. I, went into education, and I taught holistic nursing for 20 years, but it still felt confined, where there's walls, of what you can and you can't do, and knew that we had to take it to the point where, you know, we are capable of making our own decisions through our critical decision making skills that we have, what is appropriate for this person or what is not. And so, once we discovered that no, we can practice on our own, and we could have an independent practice, that kind of changed the ball game for everybody.
Mhm.
Yeah.
Yeah. And when did you become the executive director of the Integrative Nurse Coach Academy?
In 2020, yes, 2020, I was working alongside Barbara Dossi and Susan Luck. And, at that time, they knew that, a new group needed to come in and take it further, than they had. And so I was ready for the challenge, along with Ronald Kenka, who is a business partner, who's the director of business operations. And now we also have Carly Mertz, who is our nurse planner and course coordinator, for the program. And so it's growing. It's definitely growing, and lots of very skilled, um, really talented faculty who have joined us along on this journey. So it's been a really nice experience
Mm,
since then. Yeah.
yes. Yes, it has. It has been a really nice journey. And we've been connected along the lines too, because I graduated in cohort number 4 and you graduated in cohort number 2. And then
Hmm.
we've been colleagues and friends ever since then.
That's
Yeah.
right. That's right.
Yeah.
In other programs too. Yeah.
Yes. 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 So,
So in the 5 years, we've really grown as a team, I would call
mhm,
it, because people really need to, um, let or want to, and are really sharing their skills and expertise and ideas, and it's wonderful to be creative and not have to be um, overseen again and stopped through, certain walls that sometimes are put up in other places. So
yeah.
it's been great for that reason.
Well, and we know that nurses are supposed to be functioning to the highest level of their education, degrees, certifications. And nurse coaching allows and creates a space for us to be able to do that through the holistic nursing lens. And then expanding upon our education. And like you said, you took numerous courses, numerous education to advance your skills and elevate what you're doing on a daily basis, to be able to be in this position of running
Hmm.
this organization and bringing your skills and gifts to other nurses and expanding nurse coaching as a whole.
Hmm. Very
Yeah.
well said.
Right.
That's right.
Yeah.
Yeah, yeah. Nurse coaching just gives you a framework to be able to deliver. Like years ago, when I, would take all different kinds of, let's call them complementary courses, and learn things. if someone would call me for, I'd like to see you. And I was, faculty at the university, like I said, and I would get calls from the public because I somehow, was known in that venue there, and they'd like to see me for a session. And I'd have to explain what I did and all the different techniques I did and what each one cost. And it wasn't until I found integrative nurse coaching that became my framework to be able to deliver those things. So now my elevator speech is, I'm an integrative nurse coach, right, who practices complementary therapies. And together we co-create a plan for your healing experience. And so when people come in, it's really the client's choice once we review what might be possible for them. So in the middle of my session, they might jump up on my massage table and have a Reiki session, or I might pull out my computer and we do some heart math breathing, or we might, and of course, you always have nice smelling aromatherapy going.
Yeah.
You're creating an
Mhm.
environment for healing
Yes.
and reflection. And that's what I think, are missing a lot of in healthcare, is that we don't have anybody that's really being with clients. They're doing to clients.
Mm.
And the difference that holistic nurses and nurse coaches and nurses, just that's the core of who we are, really. And that's what gives us the most joy and passion in our jobs. And so when nurses come to the program, they're like eyes wide open and they're like, this is who I believe I am. And now I know how to deliver that care.
Mhm.
So yeah.
Yeah. I was really appreciating the environment in which nurse coaches really create. So no longer is it a sterile doctor's office with butcher paper on a table and that kind of environment, no plants, no white walls.
Mm-hmm.
Nurse coaches are creating environments of healing, which include the colors on the wall, to plants, to music in the background, to comfortable chairs, and like you say, being with someone is way different than doing stuff to someone.
Right.
Now we're in a conversation where we're giving and receiving from the client. The client is guiding us instead of us demanding and telling. And it's
Mm-hmm.
just such a different way of allowance, not only for our patients, but also for us as practitioners, and
Mm-hmm.
allowing ourselves to be also immersed in this very healing space as well. We're part of the space. We're an important part of this space. So it's
Mm-hmm.
just I loved. I'm looking at your background. I know it's a picture background, but it's like, well, no, I mean, this is what we're talking about. Something that
Mm-hmm.
is comfortable and welcoming and
Mm-hmm.
feels like you're coming home instead of going to get stuff done to you. you know?
Exactly.
Yeah.
Exactly. Yeah.
Yeah. Yes. And so,
So just through the years, I take this way back, where in nursing school I was taught therapeutic touch, but then when I went out into practice, it was like nobody was using it, and you were almost afraid to
mhm,
introduce something new, so it's kind of lost. So you don't have those role models of those behaviors back then. There's more now because nurse coaches are now everywhere. I mean, we are global. This is
mhm,
no longer just an isolated regional, country specific thing that we're doing. Um, so to me, when I see people from Saudi Arabia and Japan and Italy and New Zealand and all the other countries that we have students in, it means that we all really, as nurses, understand the value of those pieces that we can bring. And that's what gives people passion to continue on in nursing. It's
mm,
very sad when I start to hear people talk about, I'm thinking of leaving nursing, and I'll get those phone calls and
mhm,
I'll say, we need to explore this together, because you're only really aware of perhaps hospital nursing or what that looks like. And that may be right for some people, and that's
Mhm.
fine. But you have options and you have opportunities. And I don't think we do enough of that discussion as a whole with nurses, helping them to understand what their opportunities really are. I think nursing is wide open for different kinds of experiences and different kinds of practice that you can do. So
Mhm.
it's not just, again, following orders.
Right. Yes. Right. Not just following orders. And
Hmm.
in addition, we're also collaborative with those practitioners who may be the ones who give some orders, but we're also part of the piece of the bigger
Oh, we're
picture and puzzle.
a bigger picture.
Yeah.
That's right.
Yeah.
We're absolutely the larger picture to that.
Yes.
Right. And
Yes.
the collaboration with other professions too.
Mhm.
Um, and like wellness centers, for instance, there's nothing better than having an interprofessional collaboration going, because you can't be all to everyone.
Mhm.
And there's not like one therapy that everyone should have, or there's not one, but the nurse coach can help facilitate that coordination
Mhm.
of services, if you will, to people, and or educate them even on what the possibilities are for them. And then they're more willing to, try other things.
Mhm. Yeah. Then the patient and the client become part of the conversation and can help
Oh.
with what makes their vision of their health and wellness a bigger priority for them. It elevates it
Hmm.
because now they're part of the
Hmm.
discussion. Yeah.
That's right. That's right.
We could talk about this all day, I know.
I know. There's lots,
There is
lots.
lots. There is lots. So I was hoping that we might highlight some of the successes and some of the celebrations that Inca has experienced in the time since we last interviewed you, which was in 2022.
Okay.
That's a few years now. So maybe in the past year, some things that you'd like to highlight and celebrate.
Hmm. Well, as you know, the program, first began, it was live, and on site. And while that's an awesome experience, we also know that, COVID hit us. And it was great timing with that, because we knew that we needed, in order to expand geographically, we also had to be able to develop a course that was meaningful online. And so the program went online in 2020, and has expanded greatly, in numbers with nurses. We have organizations who are sending us, a group of nurses. We have organizations contacting us who, because of the suffering of nurses and what they have experienced and continue to experience, moral injury, and they don't believe actually in what they're doing anymore, in certain settings, that um, our program not only teaches you nurse coaching, but it also takes the nurse on a journey of self-development. And when we say journey, the trend word out there is well-being, right? So well-being, we want nurses, everyone to feel like they are in a state of well-being. Well, we know that well-being is really static. It's like in the present moment, I'm feeling well. Whereas really self-development is about well-becoming, because it's a much longer journey of, and a never-ending journey of well-becoming, right? That always has to kind of be a major part of who we are and what we do, because without that experience and being able to really develop ourselves, we can't sit with the suffering of others and really do a meaningful job with them, or take on the suffering ourselves, or all of those pieces. So it's about helping the nurse to recover, repair, rejuvenate, re-energize, and say, this is who I am, and this is how I want to practice. You have a choice in your nursing practice, but it's understanding what it is and envisioning it and creating it, right? To reach your destiny for what that might look like. And that's what the program helps you do. Of course, we also do specialty programs, which extends the nurse's education to be able to deliver different kinds of complementary therapies and education, or just have the knowledge about different topics that are trending today. We
Mhm.
have cannabis nursing, because we know that people are using it, and it's not we're selling it, it's not we're promoting it, but we're educating patients on that and what it is. We will have a new course this year on psychedelics, because that is also becoming a trending treatment, for different disease processes, if you will. And so we need to understand it, and be able to speak to it, and what it is. So we do a lot of different kinds of programs that really can advance the nurse coaches practice to what they can offer clients.
Yes, and just for our listeners, as a reminder that we do have some past episodes that speak to these topics, in particular cannabis nursing, use of psilocybin, and what some of our graduates are doing in practice. So you can look back, so you see some very recent episodes of Integrative Nurse Coaches in Action for some of that information. And then,
Mhm.
of course, I'll drop in some links too, with links to these particular specialty programs as well. So you can just click on those and you can see what these programs are about if they're piquing your interest right now.
Yeah, that's great.
Yeah. And so, okay, so in 2024, I
Mm.
would like to know your thoughts about like some of the celebrations from 2024.
Oh, 2024 brought another opportunity for us, where we had a live symposium in Miami, Florida, which was wonderful.
Yes.
And where lots of nurses came together, and we explored topics similar to that together to understand it. Talked about how to advance nurse coaching, what nurse coaches need in order to develop that confidence, right, and be comfortable, again, speaking the language of nurse coaching, and which matched really their values and their belief systems. So if you can speak the language to people that you come across, or in your workplace, or in the leadership team, and help them to understand what a nurse coach could do, not only for patients individually, but for other nurses, for the organization as a whole. I mean, we had an organization contact us, and yeah, we did 1 days for them, where the nurses were able to explore this and identify who the champions were. The idea is to put them through the program, so that then they will be able to. It's like a train the trainer kind of a program. They'll they'll be able to bring this to nurse orientation,
Mhm.
and become the philosophy for practice within the organization. They want to put board certified nurse coaches on the floor with the new nurses, right? Because not only are they helping them implement it into patient care, but they're helping the nurse themselves, in their self development. Because without that, we're seeing nurses who leave at that 24. Actually, it's actually reduced now. Used to
Yeah.
be at that 24-month mark, nurses would make a decision: are they staying in nursing or not? Well, now it's actually much earlier than that. And we
Mhm.
were having, because of the pandemic, full floors of all brand new nurses, including the nurse manager. And, needless to say, nurses learn on the job a lot of really what they need, to
Yeah.
practice. And so they weren't getting that. So not only in patient care, but this is also for the nurses and staff, within organizations. So been a lot of change that way, and recognition. So it's the recognition of the organizations who are saying, you know, okay, we're going to bring in a mental health organization, and nurses can sign up for sessions with a therapist. It's more than that. It's about the self-development and the self-growth of the nurse. We want to be able to bring that passion back into their nursing practice how they love. We want to be able to allow the nurse to really, you know, feel happy and joy where she is now. So, this is one of the things that nurse coaching can do for people.
Mhm. Yes. So I think the symposium was 3 days or 2 days. I can't even remember.
It was 2.5
Two and a
days.
half days. That's right. Two and a
Yes,
half
it
days.
was 2.5 days.
And
Mhm,
we got to meet nurses from all over the country,
mhm,
and different styles of nurses all coming together and like you say, learning to speak the language with each other so that we feel confident when
mhm,
we're out in the world, that we can be using shared language, shared culture in a way to bring these concepts and ideas to the spaces that we're living and working in. Listeners, if you want to listen to some amazingly inspiring words from attendees of the conference, the symposium, the Integrative Nurse Coach Symposium, episode number 72 and 73 are so good. Like, they're just real, live, raw voices of our graduates, integrative nurse coaches of the world, or even nurses
mhm.
who are just coming to explore and see, what is this? What
That's
is
right.
this? And realizing
Mhm,
these are my people. These are my
mhm,
people. And
mhm,
how uplifted you'll feel after
mhm,
listening to those two particular podcasts
mhm.
specifically.
And, we have people who are asking for more,
Yes.
and, um, our goal is to try to meet the needs of, nurses out there. So yes, we're thinking about how we can come together live again.
Good.
One of the things that we have going right soon in March is it's called the Holistic Holiday at Sea, and it is a cruise. We are collaborating with another group, a holistic minded group who is, actually on the cruise with us, and about plant-based eating, and all of those holistic topics that of interest. How to even like a lot of physicians who are into functional medicine, into lifestyle medicine, a lot of all variety again of different practitioners that are on there doing talks, including nurses. And so we'll see how that goes,
Woo.
together at sea. And then, of course, talking about, the opportunity to do some self-care retreats for nurses also.
Yes.
Um,
So we will, listeners, drop in the link for the holistic holiday at sea. Can people still register for that, Karen?
yes, they can.
Oh,
They can.
good.
And of course, there's contact hours for nurses also. Yeah, so
Awesome.
it should be a great experience. We're, in the Caribbean, so
Right? I mean, how can that not be a good
how can
experience?
that not be good? Yes. And especially I'm in the mid-Atlantic region right now where it's ice cold. I think it's the North Pole, so I'd
Right.
rather be there now, but
Yes. Well, and then, I know that the food will be excellent, and,
Mhm,
just the whole self-care concept, bringing that into being on a
mhm,
cruise, but with like-minded voices and learning and shared time with each other. Mhm.
mhm. Yeah,
Yes.
so there's an opportunity to eat vegan the whole time that you're there, but you don't have to. But
Mhm.
it's almost like, a good opportunity if you were thinking of plant-based to switch over because you'll have a whole week of that.
Yeah.
So yeah,
Good.
that's
And
good.
then some discussion about maybe in the future, bringing some in-person connections, maybe at different locations through the country, or?
Yes.
Okay.
Well, we have what we're doing right now is in the planning stages, and we actually have our first meeting in February, where our alumni, group will come together as a greater whole, and we'll discuss the needs and what they would like to see. I mean, we can start certainly with regional meetings where nurses in a region can come together. And that's wonderful because that support system is what nurses need, because a lot of times they don't find that support where they are. And they want to be able to bounce off ideas, continue with perhaps coaching for themselves, with each other. So I think that that's something that they're going to really like. Yeah. So the alumni expansion is definitely in the works.
Oh, very good. Yes, and all our
Mhm.
graduates are invited to those types of meetings, right? And you just
I
have
think
to.
there's about 100 alumni who have signed up for this meeting
Yeah,
already.
yeah,
So that's pretty cool. But although we have thousands, but
it's
it's a
okay.
good start. That's right.
Yeah, it is a good start, and we have to remember that people could be busy at that time or didn't know about it. There's
Hmm.
so many factors that go into
Hmm.
these types of things, but
Well, it will
those,
continue. Yeah,
yeah,
to
that's
grow.
great. That's great. So that's the Alumni Connection program.
Yeah, alumni program. Yeah.
Okay.
Yep.
What other fun things are on the up and coming?
Oh, let's see. We're rewriting the textbook, so that will definitely be out this year. Um, and it's exciting because the original textbook, it was so wonderful.
Yes,
It has
absolutely.
great information in it and all of that, but certainly our views have expanded, and so, there'll be definitely an expansion piece to it that, will help the nurses of today, understand that. And, the other, let's see, okay, the new book, um oh, I've been on the journey of CPT code recognition for nurse coaches.
Hmm.
Um, One of the big stumbling blocks is that insurance companies typically do not credential non-advanced practice people. So helping them to understand the role of the RN in being able to deliver coaching services and the difference between a nurse coach versus a lay coach um, is huge. People don't really understand the difference. I mean, all the education, the training, the experience that nurses have really put us at a different level of coaching, from others. Yes, we can do wellness coaching, but we do so much more than that. We're the true health coaches. Um, and so the CPT code recognition is one that, um, because it's run by the AMA, and it's physicians believe, some physicians too believe that they're doing it, but not doing it quite like we would do as nurse coaches. And we have to help them to understand the difference. Although a lot of them are bringing in nurse coaches because there's value based medicine a lot of places. And so the better outcomes that they can get with their clients, the more money they receive at the end of the year, right, from particular insurance companies. So there is a financial incentive to them to improve health outcomes. And certainly that's the role that we can help them with, is to improve the health outcomes. So the CPT codes are something also that, we need to strategize and say, well, how can we bill? If we team up perhaps with an advanced practice nurse, we develop a wellness center. So all of the insurance goes through that practitioner. Um, those are opportunities for being able to bill insurance. Now, the thing with billing insurance, of course, is, you know, there's a limited reimbursement with that. And so we go through that whole process of exploring that in the course, what's best for that nurse coach in that moment. Because it's not as cut and dry as, oh, I'm going to send the insurance company a bill. There's a lot more to it. Will you get reimbursed? Are you keeping the proper records? That if they come in to do an audit, you're going to be successful with that audit, or they're going to ask for money back, so there's a lot of different things to consider with that. And so it does require exploration and really, discovery of how we can best move nurse coaching forward in a way that heightens our practice, brings us as professional nurse coaches really into the realm of healthcare delivery. I mean, think about it. Nurses are not a reimbursable, we're a cost center, not a profit center in the hospital, right? And so people tend to think that in the beginning that nurses cannot be reimbursed for their services, but that's not true. So we need to change that look and that, at how people look at nurses and their capabilities.
Mm-hmm.
So
I know that you were a big voice in bringing this to the AMA a few years ago. I just wanted to just say, holy moly. That was a big step. I mean, you had to go to the AMA
twice.
Twice.
I went before them twice. Yeah.
Thank you.
Mm-hmm. So we need to be advocates as nurses for what we believe.
Right.
And we know that we have, we have the evidence to be able to support what it is we can do. We just have to really be able to continue our journey of talking about it. I'm not willing to take a no and walk away and never go back.
Right.
So I'm still on that journey. I'm trying to figure out, number one, we know that this isn't a quick process of getting through this, right? This is again one of those long trajectories of acceptance, if you will.
Mm-hmm.
But we also have an opportunity to be able to figure out how we can start right now, be able to get in that space. And then we'll be able to collect more data. We'll be able to really help support, that process for us.
Mm-hmm. So what would be like a step that a nurse coach could take in their day-to-day life to help support that process?
Well, another initiative we're working on is to create a repository for, for outcomes. So that will be released, when it's ready, where we're going to start to collect the data from the nurse coach sessions. And so that we can then try to make sense out of the outcomes and be able to use as evidence to support our recognition, really. Mm-hmm. So that's another thing, with that. We need more research specific to that. Our research often is kind of, it doesn't always, it might just say coaching. It might not say nurse coaching because they use a variety. Some organizations use a variety of coaches and they're collecting data on all of that. But we need nursing specific coaching outcomes to be able to really, drill down and be able to use that to help support our advocacy, I would say.
Well, and I'm thinking maybe a step that nurse coaches could do on a day-to-day basis is really being clear about the outcomes that they are creating with their clients. What are those outcomes? How can we articulate those outcomes and seeing them for what they really are? Because I think a lot of nurses just think, oh, it's just part of the process. And, but no, actually, yeah, you're a part of the process of that, but without our skill, without our presence and our knowledge bases, those clients could not have taken the step on their own. That's why we are of service with them. So I think recognizing our very big contributions to with our patients and not stepping back, and not taking ownership of them,
Hmm.
because we are really affecting patients and clients, our communities in big ways. And
Hmm.
yet, our nursing culture can kind of hush hush some of that.
Hmm.
So, maybe a step for our listeners is to really stand up, and maybe not stand up at first, but being clear about the outcomes that you are really contributing to, for
Hmm.
your patients, your clients, your communities, and
Hmm.
for yourself. All of that.
That's right. Yeah, without, again, finding your voice,
Mm,
finding your language, being comfortable with it, being confident with it.
yeah.
That's what's going to make the difference. We still like, when nurses first come in, they'll often be very, I'm going to use the word quiet, because they have not been an advocate for themselves in the past. And here we're, encouraging that and teaching that and speaking it. And, until they feel that level of confidence and really understand what they can bring, they tend to sit back. I mean, if you look at research, and this has, been for years, nursing, right? Um, nurses' careers are interrupted often by, family that may happen along the way. And whereas men don't have that interruption in their career journey, nurses do. So nurses have, and it's women in general, if
Mhm.
you will. And
Yeah.
there's a lot of male nurses, and I'm not saying anything against that, but often their career is not interrupted by those other components. But nurses, and women in general, and that's kind of across the board with all careers, that they really take on a lot more responsibility overall. And so, are they looking at this as a job? And maybe looking at it as a job in a particular part of um, your career timeline might be right for you in the moment. And I'm not saying everybody needs to be out there, rah, rah,
Yeah.
but you can still speak the language and be able to articulate it to your colleagues and to your leadership where you are,
Mhm.
what's needed for nursing. I mean,
Mhm.
everybody, we all need jobs, we all need benefits, we all need, good money. And so it's not everybody's ability to be able to do a private practice perhaps themselves,
Right.
because that there's ebbs and flows with that, cash flow, all of
Yeah.
those things. And it takes a lot of time to build up. So we have a lot of nurses who, keep their jobs, start in the present moment where they are. We have people who are working with the employee health departments in their hospitals, and seeing all the nurses that come in with burnout and anxiety and depression, and or doing group coaching classes on self-care in the facility with nurses. So there's a lot that nurses can do where they are. They can work with specific patient populations, diabetics, or cardiology, or
Mhm.
whatever it is. So you're bringing your specialty into that coaching experience. Um, and then, or they may slowly cut back their hours in this other job while they're building up their private practice. But it's not necessary to do that. A lot of people think, this is not for me because I don't, I'm not a business person. And no, we were not educated in business, but a lot of us have grown to learn more about that, or have had experiences perhaps at the leadership level where we've gained experience in business and understanding of the processes that we can then help each other, grow forward in that.
Right. Yeah. And I think just in general with nurses, coming into the Integrative Nurse Coach Academy, the certificate program, that's that parallel of learning the concepts of coaching, and then the professional and personal development is both
Mhm.
that you
Mhm.
receive. You don't have to. You you could stay in the same role, but you're going to function differently in that
Mhm.
exact same role just because of
Mhm.
taking the program. You're going to
Mhm.
function in a way that can align more with who you are and your authentic being and why you even chose to be a nurse. I mean, it just shifts your thinking, shifts the way you're showing up, shifts the way you handle and discuss with your colleagues, and then how much patience and love you can give back to yourself as a nurse as well. So,
I have nurses who say to me, I realize I've changed my thought process, my language with my colleagues at work. Whereas we want that to happen. We want to shift from negative talk to positive talk, right?
mhm. Yeah,
So without that love, passion, joy in your job, right, it's harder to do and to achieve. So this is what that brings. It can bring a shift really in attitudes, and because now you love what you're doing. You feel good about what you're doing. That's what it is.
yeah,
That's why nurses experience moral injury, because it's really going against their values and belief systems. And so now with this, they feel hopeful, and, giving people hope for the future, for, their jobs and whatnot is what you want. You don't want them looking for where's the grass greener, on the
right.
other side. You
Yeah,
want them to stay where they are and help them grow in
mhm,
that thought, you know.
right. Yeah. Bloom where you're planted. That's
There
that's
you
the
go.
that's the thing that I want, that I know a lot of people want, to just stay where they are and help shift your concepts, your perception of that.
Mhm. Mhm.
Okay, what else do we need to touch on?
Well, the other thing is, nurses can be really, we have nurse coach leaders. That's what I feel we develop, and what people can feel when they graduate, because nurses should be leading wellness within their organizations.
Yeah.
They should be the chief wellness officer,
Mhm.
because that's the core of their practice. So that's another thing that, we're working on, is how to heighten that, so that nurses now can be, really guiding that within the organizations, rather than another profession that's not the core of their practice, who actually has more limited knowledge in that way.
Yeah.
So,
Yes. I think you had also mentioned in a past conversation that some of the program is going to be revised a little bit moving forward.
oh yeah, yeah,
Mhm.
a lot. Different philosophies, bringing in, different methods of helping. Our goal is to help people transform. And how does transformation happen? And so we have ideas on that, and also to give people then the option to be able to, what are they most interested in? Is it private practice, or is it integration in organizations? I want people to have a tangible product when they leave, that they can then take the step the next day and right away begin to implement nurse coaching, whether it's, again, in a private practice, or it's in their present organization. And so with that support, and providing ongoing support to be able to do that longer term, will actually ensure the success of the nurses. And we all sit for
Mhm.
certification. There's a national certification in nurse coaching, there's a national certification as a holistic nurse. And if you take both, then your title changes to health and wellness nurse coach, board certified. So, we practice with that holistic philosophy, and we're bringing in the nurse coach skills and leadership into and combining it into this beautiful praxis or practice of nurses. So there's a lot of opportunities for people in different ways, now really that we understand that nurse coaching can help.
Mm, yes. Well, wonderful. Well, we'll look forward to seeing what these revisions are and how we can um, support our communities and newer nurses coming into the Integrative Nurse Coach Academy certificate program, and how the program and nurse coaching is going to evolve because of this.
Mhm.
Yeah.
And I love to hear from people too,
Mm,
what their needs are.
yeah.
And so we did do, a very large alumni survey, got lots of feedback, which is great. But there's that's what happens is nurse coaches come along and say, "I want more, and I need to learn about this now because this is out there." So
Right.
we listen and we collaborate with the specialists and experts in those particular topics to bring the best experience that we can.
Wonderful. Yes. Whew. Lots has happened in the past couple years and
Lots.
exciting things in the future, right? And things
That's
take
right.
time, it's not like just bam,
Mhm.
changes happen, right?
Mhm.
So we look forward to following along on the journey as we are all moving ourselves forward. And
Mhm.
then also knowing that, we're alumni of this amazing program that has shifted the way we are showing us nurses. I'm speaking for myself right now, how I show up in the world. Um, and I want to be able to support your journey, and I know our listeners do too. So, yeah. So, Karen, how can people reach out to you? Is there a best way to do that?
Oh, absolutely. I mean, I'm happy for people to contact me directly, Avino at inursecoach.com. I'm happy for people who want to, I mean, you can set up a time to talk with one of our admission specialists about the programs themselves. And they actually sometimes know more than I
Right.
know about the program themselves. But I think that there's many different ways to interact with us, and the more that's why the alumni connection is going to be so critical, because that we can bring groups of nurses geographically together who can really develop a close-knit collaboration and working together and support. And maybe they'll develop a wellness center together. And maybe they'll bring an advanced practice nurse. So we have nurses at all levels. I mean, I just want that to be clear is, we have nurse anesthetists and we have nurse practitioners and all kinds of nurses who feel and know that this is the right way to really practice, and as well of course as registered nurses. So it's a wide spectrum of people who can work together, collaborate, and really develop something beautiful.
Mm, yes. Well, wonderful. I will be putting in a lot of links into today's podcast notes. So please have a look at our notes, and then see, what has called to you today that maybe you would like to explore a little bit more, or reach out to a colleague that's is in your area, or if you're seeing someone on social media doing something that you really are connecting with, is to just send a message and say, hey, I noticed this, and let's collaborate, let's come together. That's how we move things forward. And of course, so many opportunities within the Integrative Nurse Coach Academy to advance your knowledge and skills, and also connect at the alumni level as well. So, Karen, thank you so much for being with us today and sharing all the goods on what's coming up, and
Mhm.
some celebrations of things in the past as well. And we thank you so much for your time. But before we go, I will say we do need to know what is on your heart that
Oh,
you would like to share with us today. So maybe a couple breaths and see what comes up.
so of course, one of the things is there's so much excitement, to be honest. Like, I feel very excited when I talk about nurse coaching and the opportunities for growth for nurses. And we do this because we believe in nursing and we love nursing. And again, we want nurses to find their voice and be comfortable speaking of what their profession is and what they can bring to the table for clients. So, it's all about finding yourself, finding your love, finding your passion, using your voice. Be strong. We One of the things that Barbara Dassey, always told us was, a strong back, but a soft front.
Mm.
So we are always open. Our hearts are open to each other, for listening and acceptance and understanding and trying to keep that strong back because that's what we believe and what our values are, and we're not afraid to speak it.
Mm. Yes. Thank you.
Thank you, Nicole.